Welcome back to Champions of Care, brought to you by Oakwood Healthcare. We're talking about hip pain today. And if your hip pain has become intolerable, or even if it's just beginning to impact your day-to-day activities, it may be time to talk to an orthopedic surgeon. And in the studio with us today, we have an outstanding orthopedic surgeon. Please welcome Dr. Eric Silberg.
Thank you for having me. It's a pleasure to be here, Mary.
We're so happy to have you. Now, you're an orthopedic surgeon, so perhaps someone has seen a family practice physician and that patient has been referred to you, or maybe someone's calling you directly, but when is it time for a patient to see an orthopedic surgeon?
Well, patients come to see me when the pain that they've had, when you're talking about hip pain, it's pain usually in the groin, in the front of their leg, and it's difficult for them to do some of their normal activities, such as put on their shoes and socks or get in and out of a car. When some of those activities are difficult for them, they cannot perform them, then they should go see their primary care doctors or their medical or their orthopedic surgeon. The orthopedic surgeon is usually someone who's going to do something further about that, so this is pain that is beyond help from a Tylenol or a Motrin or a Silberg or some other type of medication. And once they get to the point where it's affecting their daily activities, they can no longer be happy with their routine, they should see their orthopedic surgeon.
And seeing the orthopedic surgeon, does that mean we're going straight to the operating room for surgery?
No, most of the time we see patients with hip pain, we educate them. So this is the reason that your hip hurts. This is why you have the location of the pain that you have. And we try to tell them what the hip looks like. Why did it deteriorate? What they can do to help it. Some of the things that you can do for your hip pain, such as exercise, stretching, weight reduction, those things can be helpful for your hip without surgery. We can also give injections into the hip. So the first course of treatment is to figure out why they hurt, where they hurt, explain that and educate to the patient, and then offer those treatments first. If you fail those treatments, that you've tried an injection, you've tried to exercise or stretch, and you've lost weight but you're still having a lot of pain, then we might consider a hip replacement. And
what exactly is a hip replacement?
Well, when we replace the hip, what we do is we resurface the joint. So you have the hip is a ball in a socket. And when that ball is covered with cartilage, and when the cartilage wears down, the bones rub together. That causes a lot of pain. And usually, as I mentioned prior, their pain will be in the front, in their groin. So what we do with the hip replacement is we resurface the ball and we resurface the joint. And this is a hip replacement right in front of us. So what we have here, this is the femur or the thigh bone. We use a prosthesis which goes inside the thigh bone, like this. And it has a ball on it. That ball can be made of either metal or ceramic, depending on what we need. And then there's a cup which goes inside your pelvis. So that resurfaces your pelvis. There's your new ball, and that's a hip replacement.
Wow, you become bionic.
Well, we hope that you perform, you're not going to jump tall buildings, but we hope that you can be doing your normal activities without pain. So that's a standard hip replacement right there.
Are there things a patient could do to ready themselves for hip surgery?
What you should do, first of all, you get the diagnosis that you have an arthritic hip. And if you are overweight, the first thing you need to do is try to bring your weight down. If you do need surgery, it's always safer. The risks are lower with less weight. The surgery itself is easier and your recovery is easier. So if you can get yourself, I always tell my patients, if you can get yourself in the best shape possible before surgery, you're going to be in better shape after surgery. So I recommend that they find the exercises that they can do. A lot of patients will come in and say, well, I can't walk and I can't do this. And I always tell them, I don't want to hear what you can't do. Let's find out what you can do. So if we can find an exercise that works for them, they can be active, get themselves in better shape physically and mentally, and then prepare themselves for surgery.
Is there an age criteria? I always wonder, how long will a hip replacement last?
Well, if you are a patient who needs a hip replacement, you want to try to put off the surgery for as long as you can safely and comfortably put off the surgery. A lot of times, if you're not sleeping at night, you're not performing your normal activities, you're gaining weight because you're not active, then your lifestyle isn't acceptable. And therefore, I would not tell someone to live with that. But if you tried all those other remedies and you're still having pain, it's time to do the hip surgery, and the age is not the #1 thing. I've done hip surgery on a 17-year-old hip replacement. I've done hip replacements on a 95-year-old. Wow. Generally speaking, the hips will last about 15 or 20 years, 90% of the time.
Wow, that is fascinating. Dr. Silberg, we have lots more to talk about with hip surgery and hip replacement, but we're going to take a short break and then we'll come back and talk some more.